UK invests £650 million, all newborn babies to get DNA screening for genetic diseases. Imagine a world where every newborn's future health is predicted and safeguarded before they even take their first breath. That's the bold promise made by the UK government, pledging to invest £650 million into DNA technology to revolutionize healthcare for all babies in England. Starting within the next decade, every baby born in England will undergo whole genome sequencing, a groundbreaking technique that evaluates the risk of hundreds of genetic diseases. This ambitious initiative, part of the government's 10-year health service plan, will transform the NHS from a reactive system to a predictive one, as Wes Streeting, the health secretary, envisions. But here's where it gets controversial. While this technology offers incredible promise, it also raises significant ethical questions. For instance, how do we balance the benefits of early disease detection against potential privacy concerns? And this is the part most people miss. What about the long-term implications for healthcare equity? Could this lead to a future where only those with access to advanced genetic screening receive the best care? Currently, all new parents in England are offered a blood spot test for their babies, typically when the child is 5 days old, to check for 9 rare but serious conditions. This new initiative expands upon that, aiming to identify risks for hundreds of diseases early on. As we move towards a future where genetic screening becomes the norm, we must ask ourselves, are we ready to embrace this technological leap? What do you think about this bold move by the UK government? Join the conversation in the comments below. The ethical minefield of genetic testing for all. Is it possible to peek into a baby's future health by decoding their entire genetic blueprint at birth? That's no longer science fiction. It's a reality that's about to reshape medicine as we know it. But here's where the debate heats up. With the promise of early intervention comes a wave of ethical dilemmas, worries about misuse, and more questions than answers. Are we on the brink of a healthcare revolution or teetering at the edge of a genetic minefield? The UK government recently unveiled its ambitious 10-year health plan for England, a plan that aims, by 2035, to offer whole genome sequencing for every newborn. Health and Social Care Secretary Wes Streeting broke this major news to Parliament, signaling a profound shift from our current methods. Up to now, all newborns in England undergo a basic heel prick test, checking for 9 rare diseases via chemical markers. But the new approach would introduce DNA screening for over 200 genetic conditions, many of which could be managed or even prevented if caught from day one. Just to be clear, this cutting-edge genomic screening isn't set to replace the heel prick test, it would run alongside it. So parents could still opt out of genome sequencing, but the standard checks would remain in place. This initiative is being driven by Genomics England, whose 100,000 Genomes project has already tracked down actionable insights in nearly 1 in 5 participants. Now, building on this momentum, the Generation study aims to map the genomes of tens of thousands more newborns. With the help of artificial intelligence, researchers hope to predict and potentially prevent diseases long before symptoms even appear. But let's pause for a moment. Here's an important truth. Our DNA holds clues, but it's not a crystal ball. While scientists can link certain genetic changes to specific illnesses, there's a huge gray area teeming with so-called variants of uncertain significance. These are stretches of genetic code that we don't yet understand. Some may cause illness, others might be harmless. This large-scale effort could illuminate these mysteries and reframe our whole understanding of inherited disease risk. Why, then, is genetic prediction not as simple as reading our genes like a roadmap? 3 core concepts are often misunderstood: incomplete penetrance, variable expressivity, and the massive influence of environment. Incomplete penetrance means that someone might carry a gene mutation like BRCA1, which is known to increase the risk for breast and ovarian cancers, but never actually get sick. That's mind-boggling, right? On top of that, there's variable expressivity, which refers to the differing severity or type of symptoms among those who develop the condition. It's not just whether or not you get sick, but how sick you become. And this is the part most people miss. Even if you're genetically susceptible, your environment, diet, lifestyle, stress, exposure to toxins can tip the scales. How might knowing your personal risk change your behavior? Would you become more proactive about your health, or could this knowledge cast a long shadow over your peace of mind? Undoubtedly, genomic data can and will save countless lives, and it's an essential step in advancing medical science. But make no mistake, this isn't an open and shut case. The labyrinth of ethical, psychological, and social considerations runs deep. To stir the conversation further, the generation study will not analyze the parent's DNA, just the baby's. However, it opens the door to universal genetic screening before a child is old enough to consent. Some contend that telling parents about a non-treatable diagnosis could cause overwhelming anxiety, outweighing any potential scientific benefit. Others argue that such knowledge is crucial for advancing medicine, even if it's difficult to hear. There's no easy answer. An article in the European Journal of Human Genetics revealed most parents would share screening results with their children while they're still young, but others might delay, worried about knocking their child's confidence or causing emotional harm. Perhaps one solution is to focus reporting only on diseases where early treatment significantly improves the outcome. But even this is controversial. After all, who decides what counts as treatable? Diseases once hopeless, like certain inherited metabolic disorders, now have therapies thanks to gene research. Screening for currently untreatable conditions generates valuable data that could unlock future cures. Is it wise to limit the scope based solely on today's medical possibilities? But let's face it, information itself can be a burden. Take Alzheimer's disease, for example. If parents learn that their child carries a higher genetic risk, but there's no proven way to prevent the disease, how do they handle it? Ignore it? Obsess over it? The moral puzzle is deeply personal and far from straightforward. No matter what, once a genome has been sequenced, those data exist forever. Doctor-patient relationships could be strained by what they know but can't yet act upon. Patients, knowing their data is locked away due to current medical limitations, might seek answers independently, possibly deepening health inequalities if only the well-off can pay for private interpretation. Are we in danger of building a genetic knowledge gap between rich and poor? Let's not dodge the hottest button of all, discrimination. Societal fears about genetic misuse are real. Could insurers, employers, or schools start making decisions based on genetic risk, not actual performance or health? In the UK, laws prevent insurers from requiring genetic tests, but if you've already had one, they can request the results. And who else might demand access to your genetic identity? Does this level of data collection risk turning us into characters in a real-life 1984, surveilled at the biological level? Or is that simply a paranoid leap? On the flip side, we can't dismiss the tremendous gains on the table. Early detection of disorders like spinal muscular atrophy enables timely intervention, potentially stopping devastating symptoms in their tracks. No doubt, this is one of the most complex and urgent conversations of our time. We're redefining the boundaries of preventive medicine, but for every potential life saved, new ethical and social risks emerge. Where should we draw the line on newborn genetic screening? Who gets to decide? Now, let's open it up to you. Does the promise of early detection outweigh the risks of anxiety, discrimination, and data misuse? Would you want your own child's entire genetic fate mapped out at birth, or would you rather remain in the dark? Should the NHS forge ahead, or take a more cautious approach? We want to hear your thoughts. Sound off below and let the debate begin. UK and Florida launch universal newborn DNA screening, ending genetic roulette. A bold leap towards healthier futures, the dawn of universal newborn genomic screening. Imagine a world where the genetic lottery of life no longer dictates the health trajectory of a child. This is not just a dream, but a rapidly emerging reality, as both the United Kingdom and Florida embark on pioneering initiatives to integrate genomic sequencing into newborn screening programs. These efforts are not merely scientific advancements. They represent a profound shift in our approach to healthcare, moving from reactive to proactive, from generic to personalized. The UK's National Health Service, NHS, is setting a global precedent with its plan to offer whole genome sequencing to every newborn in England over the next decade. This ambitious project, building on the success of the Generation study, aims to transition from the current heel-prick blood test, which screens for just 9 conditions, to a comprehensive system capable of identifying hundreds of genetic disorders and risk factors. The goal? To transform healthcare from treating illnesses to preventing them, thereby extending healthy lifespans and reducing the burden of disease. But here's where it gets controversial. The integration of such extensive genetic screening into national healthcare systems raises significant ethical questions. How do we ensure consent is truly informed? How do we protect privacy and prevent genetic discrimination? And how do we make sure these technologies are accessible to all, not just a privileged few? These are not mere details to be ironed out. They are fundamental issues that require careful consideration and public dialogue. Across the Atlantic, Florida's Sunshine Genetics Act is charting a similar path with a 5-year pilot program to sequence the genomes of newborns statewide. This initiative not only promises to accelerate diagnosis and treatment of rare diseases, but also emphasizes the importance of voluntary participation and parental consent. The formation of the Sunshine Genetics Consortium, uniting researchers, clinicians, and innovators, underscores a collective effort to harness genomic medicine for the benefit of future generations. And this is the part most people miss: the human stories behind the science. Consider the families who can now avoid the painful diagnostic odyssey, the children who can receive life-changing interventions before irreversible damage occurs. These stories are not just footnotes in scientific journals, they are the heart of why this work matters. As we stand on the cusp of this new era, it's clear that the journey will be complex. But the destination, a world where every child's genetic destiny can be known and, more importantly, changed for the better, is worth every effort. The experiences of the UK and Florida will not only inform global efforts, but also remind us of the promise and responsibility that comes with rewriting genetic fate. What do you think about the integration of genomic sequencing into newborn screening programs? Is it a bold leap forward or a step into ethically murky waters? Share your thoughts and join the conversation.